Hey everyone, thanks for joining me on this webinar to talk about improving patient outcomes with SMS. First of all, I want to tell you a little bit about why I'm here talking to you today. Who the heck is Bandwidth anyway? We are the communications platform as a service that powers the applications that you use every day, where you live, work, and play. And that includes everything from Google Hangouts to Rover to even Solution Reach, which powers your healthcare application reminders and things like that. So I am the Senior Product Marketing Manager for our communications APIs here at Bandwidth. And I am so jazzed to be joined with MJ today. So Mary Jane, we call her MJ. MJ, tell me a little bit about your role at Solution Reach.
Yeah, thanks, Nicole. So I am Senior Director of Engineering at Solution Reach. Been there for almost about 8 years. It has been a phenomenal journey. I've spent the majority of my career in healthcare, coming to Solution Reach and being able to help improve healthcare and make a major impact in healthcare through communications has been absolutely an adventure. And it's one that I've learned so much from. And I'm excited to be sharing some of those learnings today with you.
Awesome. Thanks, MJ. Yeah, I love the healthcare industry and the impacts that such simple changes can have. So I guess let's dive right in. I've got this agenda up here for you all. In the race to improve the patient experience, what are we going to talk about today? So first of all, we are definitely going to address the elephant in the room, which is HIPAA. Then we're going to talk about SMS in action in healthcare today, and that's MJ's specialty. And we're going to touch on the 4 ways that you can improve patient experience and outcomes with SMS. That's it. So let's get right to it. So I couldn't help myself. I did a funny little cartoon because I think that HIPAA is a really scary thing to talk about. You know, you talk about regulations and protected health information, and everyone gets a little ratcheted up. But the reality is that while HIPAA is a regulation, being HIPAA compliant is mostly about just protecting that patient health information in the way that is best for your patients or your business. So if you are using or transmitting patient health information via email, you can do that. The director of the HIPAA Enforcement Agency said that healthcare providers can share PHI, protected health information, with patients' consent as long as they understand what they're consenting to, so that it's a non-encrypted form of messaging, right? So email happens day in and day out. You probably also use a messaging platform within a MyChart or some sort of patient enablement software. But then there's also SMS. We cannot forget about SMS. It's on your phone. You use it in and out every day. So if you are a business dealing with PHI, do you have to sign a BAA? Well, we can't tell you that. And I'll let MJ talk a little bit about her approach to BAAs in a second here. But I do want to say that Bandwidth supports BAAs. We are launching into a BAA program, which I'm very excited about. But ultimately, it has to be the right decision for you and your business. And MJ, I would love to hear how you kind of thought through BAAs.
Yeah, absolutely. So at Solution Reach, we do enter into BAAs with all of our customers. And we know that our healthcare provider customers are very much centered on HIPAA and making sure they're compliant. We want to support them in that. We have not proceeded with doing a BAA with Bandwidth yet. We are keeping eyes on your program as it rolls out. We are excited for it, but we've been very comfortable with Bandwidth as a conduit to being able to make sure we stay in compliance. But we always keep a pulse on HIPAA and the latest going on. But I can tell you, Nicole, that having SMS available in healthcare has been huge. And I only see that continuing into the future. And any support we can get just to make sure people feel like we're compliant and comfortable, we're excited about it. So we're keeping an eye out for your new program. It has not held us back one bit from proceeding with sending lots and lots of SMS.
Awesome. That's what I love to hear. I know that BAAs are very exciting for a lot of our customers, though. But again, I just want to say, if your patients understand what they are consenting to, it's their choice to share information in their own way. So you might decide that a BAA is the best choice for your business, and we will support that. But you also might decide, as Solution Reach had in the past, that a mere conduit exception is satisfactory. So definitely consult your legal team for that. All right. I am so excited to talk about SMS in action and give Mary Jane the chance to show off Solution Reach. So MJ, should I pull up the image of the healthcare example screen?
Let's do it. And maybe I'll just jump in and give a little bit of a kind of description of what we're seeing here. At Solution Reach, we've been sending SMS for many, many years, decades. And several years ago, we started to address a need in the healthcare industry of being able to have conversational type message exchanges. So we have a solution called Conversations that is an application for the desktop and also for the mobile app, where our customers can easily pick up those conversations with patients. And admittedly, when we first began, we weren't quite sure what type of conversations we were going to see. But as you'll hear today, the SMS and the ability to have those conversational type exchanges have really opened the doors to many, many exciting things. So let's jump in and maybe talk about some of those ways that SMS is helping us in healthcare.
Sounds good. So those 4 ways to improve patient outcomes with SMS, that's really what we're here to talk about today. Let's start with just an overview. You can, and this is not just up-leveling patient outcomes, but also your patient experience and maybe even some of those financials for your healthcare business. The first one would be scheduling and appointment reminders. I think that one's pretty basic. Almost everyone is up and running with those today. The second would be intake and billing. So SMS to send your patients their intake forms or billing reminders. The third is medication reminders. And we're going to talk a little bit about medication adherence and how critical that is and how SMS can help. And then finally, there's a whole world out there of healthcare interventions that I am so excited to talk about because MJ has given me a little bit of a preview of some stuff that they're working on to create a more personalized healthcare experience via messaging. So let's start with what we know and love, scheduling and appointments. MJ, can you tell me more about something as simple as scheduling and how it affects the providers you work with?
Yeah, so we've found with our online scheduling tools, and we have one, but they are very prevalent in the industry, as the audience probably very well knows. We found that patients prefer very much so to be able to schedule online, to be able to make adjustments to their appointments online, and to be able to just have that be able to do that any time of the day. What's been really exciting as we've been watching, and to keep this tying back to SMS, is that when a patient goes online to schedule an appointment, it is very quick and easy to also gather additional information from them, starting that conversation around that particular appointment. So whether it's updated information about their insurance or their healthcare condition or why they're coming in, it feeds additional information that's current and accurate into that appointment. So when those appointment reminders start going out, they can be very, very timely and they can be relevant to that situation. The office is highly informed about what that patient's coming in for, and they have the most current information. At Solution Reach, our appointments, and I'm sure almost everyone on this call has probably received an appointment reminder text before, but we've found that what is most effective is that we send not one, but we recommend sending 3 appointment reminders per appointment via SMS preferably. And the reason for that is so many patients just forget, and I know I've done it myself, just forget to make it to that appointment. But if you have a reminder go out a few weeks before, a few days before, a few hours before, just confirming, it is going to increase the chances of that patient arriving to that appointment. And again, with online scheduling, it's an appointment time that the patient found and was able to fit into their own schedule. That increases the ability for them to show up. When they show up and they have all the information that was gathered during that process, it just starts to set up this appointment to be more of a perfect appointment where before there was maybe a clipboard handed out or a stack of papers handed to them. And we'll talk a little bit about more intake, but really being able to get that first step of helping patients remember and show up to the appointment that they picked up online has made a huge difference for healthcare providers, which just means better healthcare outcomes.
Oh, totally. I'm maybe a little bit ashamed to admit that it was, only maybe 2 weeks ago that I missed a doctor's appointment. And they didn't send me a text message reminder, but they also didn't send me an email reminder. So appointment reminders are so critical. And I felt really awful, but I'm just so used to it, right? Like all of my other providers send me a text message and an email, or, whatever I've picked as my preference. And it's not just scheduling appointment reminders or sending appointment reminders for in-office. It can also be something really crucial, like scheduling and reminding patients to complete at-home screening tests. That's one example of how text messaging has been shown to improve patient outcomes. One study actually showed, they did a study on colorectal cancer screening, and it showed that sending patients text messages at home with a series of reminders, not just one text, but a series, improved the number of return test kits by mail by 18%. 18%, that's like a huge thing that doesn't cost a lot of money. So really, really great intel there. As we look beyond scheduling and appointments, this is the one, MJ, that I have to admit, intake and billing was not top of mind for me. I've had a couple of providers send me a link to fill out my forms ahead of my appointment via text message, but it's not as common. So can you tell me a little bit more about what you're seeing with intake and billing improvements?
Absolutely. So digital intake, it's very basic. We want to replace the paperwork. We want to replace the time in a waiting room that's spent in a waiting room with pre-appointment digital work, so that things are much more streamlined and much more efficient. Keeping us focused on SMS, though, what we're seeing is that with the 98% of all SMS messages being opened compared to a much lower rate on email, being able to provide options like intake that brings such incredible efficiencies to offices has just catapulted. As people become more and more reliant on their phones, I read a study where it referred to, on average, a person checks their phone 150 times a day. To be able to say, I know, and I'm like, oh yeah, that's guilty of that. But to be able to say, we need this intake information before you come in, or we have a balance that we need you to address. Sending that message via SMS and providing a smooth user experience to complete an intake form or make a payment that is initiated by SMS is going to result in a much higher completion rate. You're going to end up with many more patients saying, yes, like I want to be able to pay online. That is my preference. Yes, I want to be able to quickly fill out an intake form from my phone. And my phone's whether I'm sitting and waiting somewhere for something, I can complete that work then. And if we're sending appointment reminders a few hours in advance of an appointment, and maybe that appointment reminder reads a little differently if that intake form hasn't been completed, they click the link right there, they complete the intake form from their phone. So it's not just the SMS alone, but everything else that we're building and providing to bring these efficiencies. Without SMS, it's just not going to ever get to the point where it's having the impact that we're seeing it have today.
Yeah, I don't want to ignore these stats up here on the screen. I mean, when I read that 61% of denied insurance claims are from incorrect data entry on paper forms, that blew me away, because I have had that happen to me. But also I've had a provider sit down with, not every provider will do this, but I've had a provider sit down with me and be like, you answered this question in this way. Is that what you meant? Because this is what, they actually have to kind of walk me through it. And so I think that, the ability to kind of look at it ahead of time, get it to the provider ahead of time so they have the ability to walk it over with you, that would be really, really crucial. And like you said, 80% of patients prefer to use digital tools. I think that's so, so important. But there was something you said to me a couple of weeks back, MJ, about how text messaging and for even intake and billing can improve patient outcomes. And it had to do with the patients the billing not being a barrier to their care. Can you walk me through that a little bit?
Absolutely. And I think, going back to that stat, so many patients prefer to pay online, which makes us wonder, why we still receive so many paper invoices. I know I pull them out and I immediately look for the URL so I can go online because I'm not going to write a check and I'm not going to mail money anymore. So I look for that. But I think that experience is very much part of our healthcare journeys. We know that as balances are hard to collect, but we have seen that when payment requests go out via SMS, they are paid much quicker than if they're paid on paper. And what I truly believe is that a paid balance keeps the avenue open for additional care. As soon as there becomes an unpaid balance, is there a possibility that a patient is reluctant to come in for their next appointment? Whether because they are financially unable to pay for care, or is it that they are a little uncomfortable knowing they have an unpaid balance? Any barrier that's put up between a patient and their healthcare provider is one that we need to knock down because it is preventing the best possible healthcare outcomes. And if we can make making payment easy, I know I've had unpaid healthcare balances simply because I've forgotten to pay them. But making it easy to be able to keep on top of things and understand my balance and where to go to pay in a media that is available to me that I'm looking at up to 150 times a day has just made such a big difference. And I really think, it's part of what we're doing to improve healthcare outcomes. It has a financial piece to it as well. We want to make sure people are comfortable getting the care that they need.
I'm kind of laughing over here because I'm remembering being, I don't know, in my early 20s, not super great with money yet and having unpaid balances and not wanting to go to the doctor because I was like, I don't want to have the conversation of I can't pay that right now. So thank you for hitting on that because I think that's really critical.
Nicole, maybe I'll just chime into speaking of early 20s, right? we're figuring out the world, but a lot of it remains true still is that being able to feel that connection to your healthcare provider. And I do think SMS is more of a conversation than an email. Emails are fantastic, but we look at the way the world is shifting and changing in all industries, and being able to connect with a business or a provider via SMS keeps it a very personal and very friendly, connection. And even if it's an automated reminder to come to an appointment, or it's a system-generated payment reminder, there is a way to put a personal touch on that and through an SMS message that makes that connection feel very real. And again, we keep providers connected with the patients, and we're going to improve and transform healthcare.
Yes. Thank you for touching on that. I completely glossed over what we call the intimacy of your messaging inbox on your phone. You're absolutely right. The ability to not just feel a little bit more of a personal connection to your provider, but also, just speaking to that, the barrier to healthcare because you're afraid to pay a bill. It's so much easier to text your provider back and say, I could use a little help with a payment plan. What are my options? And having to get on the phone and, I'm sure there's shame, there's difficulty with that. So there's a lot of different ways. And if you have a service with text messaging where you might send out automations, but they can reply back and actually ask their provider questions or their provider team, that's huge. I think that's a great thing to touch on. Now that we've touched on the really critical part of text messaging, which is the intimacy of the inbox, which has, from my perspective as my job, I should have touched on that in the beginning.
But I think we've got lots of other stuff prepared to talk about that, right? Especially when it comes to that we talked about appointment reminders, that's just the beginning. I think throughout the industry, every patient has come to expect an appointment reminder. So there's so much more we can do to make sure we have such an individual, SMS experience that really makes a big difference. Medication reminders. I think, we've got some great information here. Nicole, like, I think when I read through this, I keep going back to that intimacy, right? Like, it's not a, hey, Mary Jane, remember to take your medication. It can be very specific with very specific instructions on what to do. And the power of that, right? It's such a personal, like, here's the care that you need, Mary Jane, instead of blanket statement or generic information. And again, just Nicole, how you talked earlier about the HIPAA. If a patient consents to receive SMS, healthcare information via SMS, such amazing, powerful things can take place.
Totally. I mean, when I was doing this research, it blew me away that medication adherence, so the impact that has on a patient's care and on the industry itself is so huge. So I believe it was for optimum care, the number was patients need to take medication about 80% consistently. But in the US, the compliance for medication hovers around 50%. That 50%, just the 30% decrease in compliance, results in almost $177 billion in direct and indirect costs for the healthcare industry, from 50% treatment failures per year, 125,000 deaths per year, and 25% greater hospitalizations per year, just from medication non-adherence, which that blew my mind. So I think there's a lot there that we don't consider or talk about, but you are so right, MJ. Seeing a demand for that personalized, intimate care channel. Let's maybe talk about care flows and healthcare interventions and some things like that. Yeah, I know. I was just going to say, I know that pervasive health issues like diabetes and heart disease, those things require a lot of patient self-management. And the impact of that, what kind of impact could that have in your mind, MJ?
Yeah. So I don't know the specific other than huge impact. But the reason why we don't know, we can isolate one or two use cases, one or two different condition, put together some best practices around messaging. But what we've learned, and hopefully for the audience, this rings true as well, that it is so complex. And there is so much variety. It is hard to prescribe a certain communication cadence around a particular condition, because you can get, best practices put in place. And the one thing that will always be the variable is the patient and their unique situation, their unique needs, their unique health conditions, any piece of their experience that you want to make sure is taken care of. It's always going to be the variable. So while we have seen very, very exciting use cases to put SMS into play, we've got some ideas listed here on a slide that I think we can all relate with that time where we were handed the packet of paper post-care with a very good, thorough walkthrough of what it needed to be. And all that information just left our minds as we left the healthcare, or we just don't feel well and trying to remember when to take a medication, trying to remember when I need to schedule my next appointment, what the next action is hard to do. So if we can now imagine SMS, which we've already established as an intimate and timely and effective way of communicating, and start to think about what could we do to improve a care flow. So not prescribing, this is the one thing to do for diabetes or for heart disease prevention. These are the three messages you need. But building solutions that are flexible enough for a healthcare provider to put them to use, no matter the condition, no matter the procedure, and no matter the patient. And so all of a sudden we have a tool where we still bring automation efficiency to the healthcare provider because it's software that's going to help do this for them, but allow them to dictate, allow them to design and configure the experience for each patient and do it in a way that's very, very efficient. So at Solution Reach, we are focused on building a healthcare system where these messagings that we've been sending for decades now, and these practices we've learned, we are now able to allow our customers to begin to design their own experiences. Now that we've hammered out SMS, we've hammered out email, we know how to get them, we know how to be effective and compliant and design them in the right way and deliver them at the right time. Now we need to be able to allow providers to say, here's the experience that I'm working so hard to provide my patients. how can I do it better with SMS? And it is incredibly exciting. And just to be able to say, we've got experts in messaging and healthcare communications. We have healthcare experts. Let's bring them together and provide tools that allow the healthcare experts, providers, to do exactly what they need to do and leverage the power of SMS to improve the patient experience, but even more importantly, improve outcomes because they are easier able to adhere to what the healthcare expert advises them.
You're so right. And I'm so excited for the future of, innovation in messaging and communications for healthcare and telehealth in general. I wanted to let the audience know, there is evidence for this. So I believe diabetes was one of the studies that they did, and it's the leading cause of death, the seventh leading cause of death in the US in 2017. And over 5 million people are expected to have type 1 diabetes by 2050. So these are big, scary numbers, lots of the population. With one study with diabetes for text messaging, they found that they improved the glycemic control compared with usual care by almost an entire %. So just it doesn't have to be huge impact. Little bits of impact help. There's also, I think it's almost 750,000 Americans that die each year from heart disease, and colorectal cancer is the third leading cause of cancer-related deaths in the US. So imagine these having impact on these big, devastating diseases, illnesses, with the text messaging for heart disease. You can see it, the first example is the text messaging for diabetes, where they're saying, hey, you're gonna have this follow-up. Here's what you have to do for your sugar levels. But the second one is just take a 30-minute walk, And so there was a study that showed using these automated text messages that were lifestyle focused, a life cycle focused support system. It was super effective. It was rated as 91% of effective by all participants. And after 6 months, they saw that the LCL levels were significantly lower in the participants versus non-participants. And there were concurrent reductions in systolic blood pressure, significant increases in physical activity, and a significant reduction in smoking. It went from 26% to 44% of people had reduced their smoking. So that's huge. I just think it's so important to touch on this. And I couldn't have said it better in that same diabetes study. She said, as a low-cost intervention, we believe text messaging has a great potential to improve the management of diabetes, especially among patients who struggle due to employment, transportation, and other barriers to access healthcare services. The thing about that is you could replace diabetes with just about anything. Mm-hmm. There are ways to utilize text messaging to improve patient outcomes all across the board. And I'm just so excited to see people taking more and more initiative and innovating those programs. So MJ, you are one of them, and I'm excited to see what Solution Reach does next.
Yeah, I'm excited too. I really do believe that we can transform healthcare through communication. We've talked today about how SMS is accessible. Using these modern solutions and modern software to help us accomplish that is amazing. And then, of course, keeping it personal. I'm excited for Solution Reach because we're doing some great things. I'm excited for anyone in this space who's working hard to have an impact on healthcare. I'm excited as a healthcare consumer at the opportunities of having better and better healthcare just by staying in touch and feeling connected with my providers and making sure I get the timely information I need to stay healthy for myself and my family. It's an amazing industry to be in. It's an exciting time. The past year has proven to us that we can adapt, we can move quickly, we can innovate, and we can meet needs all over the place. So it's a great adventure, and I'm excited to see what lays ahead.
I couldn't agree more. It's a good time to be in healthcare. It's a good time to be in text messaging. I think there's some awesome future innovations to look forward to. I wanted to let everybody on the call know that I do have a list of resources here. I'm not sure if we're able to attach those links, but if you are interested in the research we did to learn more about this, anything like that, please, please, please book a meeting with us today. You can use this QR code, scan it, fill out the form, and we will get back to you. But, we're happy to answer your questions. We want to be there for you, not just from a messaging perspective, but also from the healthcare perspective. And I think we can definitely work together to get some of these innovations going. So thank you for taking the time to watch this today. MJ, thank you so much for joining me today.
Yeah, Nicole, thank you. Yeah, it's so fun to speak with someone who has equal passion for making a difference in healthcare. So thank you, Nicole. Thank you, Bandwidth, for being amazing partners. Solution Reach, I personally really appreciate everything you do for us.
Awesome. Have a great day, everybody.